Hello everybody. Today we are going to discuss the question which was asked in DRMB Critical Care exam April 2024, that is indication and contraindication of plasmapheresis. So according to the ASFA, the indications of plasmapheresis are acute disseminated encephalomyelitis, acute inflammatory demyelinating polyradiculopathy, that is GBS, acute liver failure, age-related macular degeneration, amyloidosis, anti-GBM disease, atopic dermatitis, autoimmune hemolytic anemia, babesiosis, burn shock resuscitation, cardiac neonatal lupus, chronic focal encephalitis, chronic inflammatory demyelinating polyradiculoneuropathy, coagulation factor inhibitors, complex regional pain syndrome, cryoglobulinemia, cutaneous T-cell lymphoma. Dilated cardiomyopathy, erythropoietic protoporphyria, liver disease, familial hypercholesterolemia, focal segmental glomerulosclerosis, graft versus host disease, HELP syndrome, hemophagocytic lymphohistiocytosis, hemophagocytic syndrome, macrophage activating syndrome, heparin-induced thrombocytopenia, hereditary hemochromatosis, and hyperleukocytosis. Then hypertriglyceremic pancreatitis, hyperviscosity, hypergammaglobulinemia, IgA nephropathy, immune thrombocytopenia, inflammatory bowel disease, Lambert-Eaton myasthenic syndrome, lipoprotein hyperlipoproteinemia, malaria, multiple sclerosis, myasthenia gravis, myeloma cast nephropathy, nephrogenic systemic fibrosis, neuromyelitic optica spectrum disorder, N-methyl D-aspartate receptor antibody encephalitis, overdose, envenomation, and poisoning. Then paraneoplastic neurological syndrome, paraneoplastic demyelinating neuropathies, then pemphigus vulgaris, Sydenham chorea, peripheral vascular disease, polycythemia vera, post-transfusion purpura, PML associated with natalizumab, pruritus due to hepatobiliary disease, psoriasis, red cell alloimmunization, prevention and treatment, scleroderma, sepsis with multi-organ failure, sickle cell disease, acute and non-acute, steroid responsive encephalopathy, stiff person syndrome, sudden sensorineural hearing loss, SLE, thrombocytosis, thrombotic microangiopathy, coagulation mediated, complemented mediated, drug associated, infection associated, TTP, transplant associated, thyroid storm, toxic epidermal necrolysis, heart transplant, whether it is cellular rejection, cellular or recurrent rejection or for rejection prophylaxis, then hematopoietic stem cell transplantation, liver transplant for desensitization and avio liver donor, then lung transplant, kidney transplant, uh, then vasculitis, this IgA nephropathy, other vasculitis which is related to the hepatitis B, polyarteritis nodosa, VGKC antibody related disease. Contraindication: patient who do not tolerate central vein, central line placement, patient who are in active septic state or hemodynamically unstable, patient who have allergy to FFP or albumin, patient with heparin allergy, patients with hypocalcemia, patient with AC inhibitor advised to stop taking medication at least 24 hours before plasmapheresis. Thank you guys.